All right, welcome back to ABA Exam Review and the continuation of our RBT Practice Exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're turning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A behavior plan includes measuring how long a client engages in tantrum behavior. However, the technician mistakenly starts timing from when a demand is given until the tantrum begins. What type of data is actually being recorded? So we have a measurement question. And with this measurement question, the question wants you to identify what type of data is being collected actually by the technician. Meaning, originally, the technician is supposed to be measuring how long the client engages in a tantrum. So when we measure how long a behavior lasts or response lasts, we're measuring duration. It's the length of a response. The technician, however, starts timing from when demand is given until the tantrum begins. So from the SD to the start of the behavior. So when we measure from or how long it takes for a response to start after the SD is given, what type of data is that? A, inter-response time. Well, inter-response time is time in between responses, not time in between the SD and the response. B, duration. Duration is what's supposed to be measured, but we know that's not occurring. Duration is how long the client engages in tantrums. What's being measured is time in between the demand and the start of the tantrum. So what we're looking at here is latency, how long it takes for the tantrum to actually begin. And then D, rate can't be rate because we're measuring time, and rate has to do with frequency. Frequency or rate is just frequency with a time component added. So if we're measuring from the demand or the SD until the start of a response, we're measuring latency. During a DTT session, Lori presents a picture of a dog and says, "What is this?" The client says, "Dog," and Lori immediately delivers a preferred edible and says, "Good job saying dog." In this scenario, what is Lori's verbal statement, "Good job saying dog," most likely functioning as? So we're looking specifically at the statement, "Good job saying dog." And we want to know what's it functioning as. What's the purpose? So we're looking at a DTT session. And with a DTT session, we have a chain of events, right? We have an SD, a possible prompt, a response, a consequence, and a pause. With Lori, Lori presents the picture of the dog, which could be the SD, says, "What is this?" which could be the SD or the prompt. The client says, "Dog," which is the response. Then Lori delivers an edible and says, "Good job saying dog." So the consequence is the combination of that preferred edible and Lori saying, "Good job saying dog." Now, knowing that, what is that statement likely functioning as? Well, if you look at A and B, a motivating operation or a discriminative stimulus, if you know the order of operations and just went through it like we did, well, you know it can't be A or B because A and B are both antecedents. "Good job saying dog" is a consequence. So you can immediately eliminate A and B. And then we have to look at C, a condition reinforcer. And if Lori is pairing edibles with this statement, then it will likely most function as a condition reinforcer. D has the same explanation as A and B. We've identified that this statement is a consequence. A, B, and D answer choices are all antecedents. So regardless, let's say you don't recognize a condition reinforcer. If you do understand and you did attack the question and understand the order of discrete trial, then the only possible answer is C. That's why we always start by attacking the question. Joey is teaching a client to wash their hands using a backward chaining procedure. The client has mastered all steps except turning on the water, which is the first step. How should Joey implement the next trial to continue the backward chain effectively? So we're looking at Joey's implementation of a backward chain. And how do we implement a backward chain? With the backward chain, we've got our task chain that we've created from the task analysis. And we're going to teach the last step first. So in the case of washing hands, let's say it's a 5-step procedure. we're going to prompt to begin the first 4 steps, and then that last step needs to be done independently by the client. But in this case, the client's mastered all steps except the first one. So if we've mastered every step except the first one, how are we going to now teach that? Well, now the client needs to do the first step independently. That's how our chaining works, right? Whatever step we're on has to be done independently, along with the other steps that they've learned, and then we prompt through the rest. If we've already done all the other steps, then now this client has to do this first step independently. So how are we going to implement the next trial? A, prompt the client to turn the water on, and then allow the client to complete the chain independently. We will allow the client to complete the steps they know, but we can't necessarily keep prompting them because this is the last step, and with the backward chain, they have to do that first step independently. B, reinforce the client for completing the entire chain independently. Yes, that's what we're trying to achieve. So if we're doing forward chaining, you're teaching the first step independently, then the first and second, so on and so forth. Backward chain is just reversed. We have one step left. They've got to do the whole thing by themselves. C, prompt the client through the entire chain. Well, that'd be the worst thing, right? Because they've already mastered all the steps. Introducing prompts is not going to be helpful. It's not what we're trying to accomplish here. So, how should Joey implement the next trial to continue the backward chain? He's going to want to reinforce the client for completing the entire chain independently. A supervising analyst notices that a client consistently exhibits an increase in problem behavior whenever a specific therapist is present, but not with other therapists. This observation suggests that the presence of that specific therapist may be functioning as a what? All right, this is a good question because it's a little bit challenging. We're looking at the presence of the therapist and the purpose or the function of that. Well, what do we know about the presence of that therapist? We know that the analyst says the client has an increase in problem behavior when that therapist is present. So immediately, we have to think about stimulus control. Stimulus control occurs when a behavior, the frequency or the amount of behavior changes in the presence of a stimulus. In this case, problem behavior gets worse. Now, why might that be? Well, if that therapist in the past has reinforced that behavior, then that therapist has become what? They've become a discriminative stimulus. They could possibly be signaling the availability of reinforcement. And so A seems like a pretty good answer. If that problem behavior increases in the presence of the therapist, that therapist is likely signaling reinforcement is available, making them an SD. Why are they not a conditioned reinforcer? Well, they're the antecedent to the problem behavior. So this is a good video on why knowing antecedents and consequences are so important, right? The therapist is an antecedent to the problem behavior. They're not the consequence. C, a motivating operation. The therapist is not changing the value of a consequence, but they're likely signaling it's available. Remember, a discriminative stimulus signals availability. A motivating operation increases or changes the value of a consequence. And then D, a conditioned punisher. Well, we know the behavior increased, so it can't be punishment. And the therapist is the antecedent. So the therapist is likely signaling availability of reinforcement. They're likely functioning as a discriminative stimulus. A behavior technician is implementing a skill acquisition program to teach a client to make a sandwich. The technician provides specific instructions and physical guidance for each step, and once the sandwich is made, the client is allowed to eat it. The technician also ensures the client remains safe during the task. Which of the following best describes the technician's primary responsibility in this scenario? So we're looking at the role of the technician in this scenario, right? And it's a longer question, but it's not that difficult. Okay, what is their primary responsibility? And what is the primary responsibility of a technician in general? Well, it's implementation. So in this case, the technician is implementing the skill acquisition program to make a sandwich. They're giving instructions, they're giving prompts, they're ensuring the client remains safe. So what is the technician doing? What is their responsibility in the scenario? A, designing new intervention strategies if the current program is not effective. Well, that is not the technician's job, right? Technicians don't design intervention strategies on their own. B, train stakeholders on current plan implementation. Also not the primary responsibility of the technician. Can technicians help with parent training? Of course, but it is not their primary role. C. Conduct functional behavior assessments to determine appropriate skills to target. Can technicians help? Yes. Is that the primary role? No. D. Accurately implement skill acquisition and behavior reduction plans as instructed by the BCBA. Yes. That's the primary responsibility of the technician. Implementation of the treatment plan as trained and directed. Thanks for watching. Please subscribe. It really helps us out. Check out btexamreview.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard,